was last time we met as a GLAD working group on social protection. It was in February, so it looks like been ages since that discussion happened. And of course, the whole global situation converted to a new reality for all of us. But we really thought it was timely for us to reach out and group again and discuss with you and get some updates from all members on what is happening around the globe on disability and social protection. We know that for a fact that the impact of COVID on persons with disabilities has been massively impacting their well-being, and unfortunately in many countries it has caused a lot of implications on their daily living, on their health, on their access to services. And of course we know that social protection is one of the key areas that has been also highlighted as a potential venue for protection, for provision of additional basic services to people with disabilities in many countries. Yet many challenges has been emerging, as it has been unfortunately the case always when it comes to response to crisis and disability, and specifically when it comes to social protection. So our discussion today is really, again, to have a discussion with you, update you from what's going on at our end, but also hear from you equally any updates or any discussions moving forward. Alex, can we go to the next slide to just discuss the agenda? So what we're hoping to achieve with you today is really, as I said, more of a stock taking about what is happening on social protection, but we have an interesting element of discussion as well, of hearing from organizations of persons with disabilities and partners that we have been also working with to hear their perspective of the context of the situation of persons with disabilities in their countries, specifically when it comes to social protection. We're also going to hear updates from GLAD members, including some of the global initiatives, but also some of the specific work going on at country level. And we're also going to hear about the initiative of the help desk that is done in collaboration between DFID and GIZ, along with other updates from other members. We will end up as well with some key advocacy messages that we would like to share and discuss with you and get your views on, and then hopefully agree how we would collectively disseminate them moving forward. So looking forward to our discussion, and now I move back to Alex to start with the first point in the agenda. Alex, back to you.
Thank you very much, Ola. So what we would like to do briefly at the start is trying to review a little bit what have been the key measures that have been taken by states in support to persons with disabilities. And before we do that, very briefly recapping a little bit what would we expect from an inclusive social protection system with regards to support of persons with disabilities across the life cycle. The first one is basic income security and adequate standard of living. The second one is ensuring coverage of costs related to access to healthcare, including early intervention, rehabilitation, and assistive devices. The next one would be coverage of disability-related costs, including access to support services. And the last point would be facilitating access to early childhood development, education, and economic empowerment programs. So we started in May reviewing the different trackers that have been in place globally from the ILO, the live paper that started from Ugo Gentilini from the World Bank, and now adding also some trackers from ECLAC, UN ECLAC, trying to see what countries are doing in general and more specifically for persons with disabilities. Overall, the key lesson learned, which is unsurprising, of course, is that countries who have a comprehensive social protection system are in much better place to provide a response fast and comprehensive. We can see as a key challenge for countries, and we will have the opportunity to come back to this point in the different stage of of this meeting. Major challenges for countries. We do not have a national disability registry and or a national disability card system or ID system, basically because they cannot identify person with disability and channel the support they want to provide. So the crisis definitely demonstrates the importance for all countries to develop and strengthen collectively financed, comprehensive, inclusive, and permanent social protection systems. So looking at the measures, over 195 countries in the world, so the quasi-totality of countries in the world, have announced social protection measures of some kind for the population. Over those 195, 75 have made specific mention to persons with disabilities. So it can take different shape. It can be, for instance, extending an existing scheme to persons with disabilities. It can be also modifying or making a one-off payment for disability benefits, so an extra payment. We'll come back to that. It can be some in-kind support, etc. So it's not uniform, and it really varies between countries. In this work that we are doing, we focus more on low and middle income countries, considering that the level of coverage and support that persons with disability may receive in high income countries is disproportionately better than what we have in low and middle income countries. It's not to say that there are no problems, and I think that we have seen in several high income countries the impact of over-reliance on residential care institutions, including in Europe, both for elderly people and persons with disability of adult age and children. And this is something that OACHR and other agencies will inquire in the coming weeks and months. So focusing on the countries and the type of measures that have been taken, there have been specifically very few job protection related measures, specifically for persons with disabilities. There has been quite a lot of cash transfer one-off elements, which could be an extra payment of an existing benefit, so a top-up basically, or it can be a one-off payment of a benefit that does not exist. One of the most, I would say, unusual was in Sierra Leone, when they announced that they would distribute rice plus few essential items and protective gear together with a bit of cash to persons with disabilities that they have on their listing. So that this kind of form, and it goes to India, who provide extra payment for all the beneficiaries of the disability, the union disability pension. Very few countries have announced expansion of schemes per se, or new transfer schemes. We have Rwanda, Lesotho, Suriname, Sri Lanka, Kenya, and also Tamil Nadu. We will have Meenakshi and Fatma giving us more detail in a minute. So we cannot say that today there has been huge expansion of cash transfer support towards persons with disabilities. And one of the reasons for that is that countries do not have the list. They do not have the database to do it. So that's a big barrier to expanding support to persons with disabilities. We have heard in many countries from DPOs the fact that governments are asking them list of persons with disabilities to be able to channel support. I will come back to that in a minute. Some countries have adopted payment in advance, which on the upfront may seem like a good idea immediately, but then there are questions now is what happened when the next payment is supposed to come and it has already been paid. So that's one of the concern. Many countries have adopted in-kind support such as food distribution. Several states in India, Mauritius, for instance, as targeted people who are benefiting from the caregiver allowance, assuming that they will have a lot of difficulty to get the food themselves. Peru has developed a specific helpline trying to reach out to persons with disabilities, seeing if everything is okay, if they need any support. So those kind of measures have been taken as well. Several countries, both high income and low income or low and middle income, have made change in administration. For instance, in Armenia, the delivery of cash transfer has been done at home to avoid, to prevent persons with disability to go in places where they might be contaminated. In South Africa, they had special days where people with disability and elderly people could go and pick up the benefits so that they do not get in the crowd. In South Africa as well, persons with disabilities that have the disability card could take taxi, including in hours of lockdown where transport is prohibited. So there was exception made so that they can actually reach to payment point or healthcare, for instance. Some feedback that we got, we held many webinars with the International Disability Alliance, with DPOs from South Asia, Southeast Asia, West Africa, East Africa. And the picture we got is mixed, of course, but there are few elements coming quite strongly. The first one, and that would surprise nobody, is the challenges people face in getting access to information. But many DPOs mentioned that some effort have been made, specifically with regards to sign language, but in a very unsteady way. So for instance, you would have sign language information on major announcement for a few weeks, and then it disappeared. So there is no consistency in many countries in terms of how to ensure that information is made accessible. When measures have been taken, for instance, to distribute food to the general population or to vulnerable groups, mostly poor people or informal workers and households, there has been some challenge in accessing this kind of support, both in terms of information and accessibility. But again, many DPOs were mentioning some efforts, for instance, asking DPOs about the list of people with disabilities to be able to outreach to them directly, or trying to create or to have special time where a person with disabilities or their family could come and pick up foods. But again, it's very unsteady, and it shows that most countries, despite there is more awareness, I think we can say that, than years ago, but it has not translated yet in systematic inclusion in emergency response or social protection for that matter. Most countries in low and middle income settings do not have cash transfer for persons with disabilities, and when they do, it's usually with very limited coverage. So it has severely limited responsiveness in the crisis. As I mentioned, there is a lack of outreach in countries because there is no national disability registries, and existing broad registries do not always feature identification of persons with disabilities, which has been one of the key questions in expansion of the support to households, which is how do we identify quickly persons with disabilities. And one element that came quite strongly also is that the critical lack of publicly funded support services, such as personal assistance support to children with disabilities, which is usually difficult, has been particularly painful during the lockdown or the different restrictions because of the disruption it created to informal support usually existing and NGO support, etc. So that's also something that has been quite strong in terms of feedback. We will come back to that later. In terms of key measures that we see needed in the coming year, would be definitely ensuring that economic recovery programs are inclusive, The development of national disability registry. We know that the crisis will have long-lasting impact, and we definitely need to support countries to have those disability registry with information about support requirements of persons with disabilities to be able to be the most responsive possible, and how best they can combine their mainstream social protection scheme with disability specific to ensure basic income security, coverage of healthcare costs, and disability related costs. One point that came quite strongly, again, as I mentioned, the lack of community support services program for persons with disabilities, and of course, in many countries, the issue of deinstitutionalization, how to build greater connection between social protection intervention and the support services. And one point that is critical, and we'll come back to that at the end of the meeting, preventing austerity measure in recovery fiscal consolidation, which is likely to happen. How do we ensure that persons with disabilities are not negatively impacted by fiscal consolidation? So I would like to invite now Fatma Waronge from Inclusion Africa to give us a perspective on those issues from Africa and more specifically from Kenya. Fatma, the floor is yours, and let me know when you want me to shift the slides.
Okay. Thank you very much, Alex. Thank you so much, Paula. Good morning, good afternoon, good evening. My name is Fatma Wangari. I'm the Regional Coordinator for Inclusion Africa, which is the regional network for people with intellectual disabilities and their families. I am a parent. I have a daughter with an intellectual disability, and Inclusion Africa is the regional network for Inclusion International, which is a member of the International Disability Alliance. I am humbled this afternoon to talk to you on the African perspective on inclusive social protection, looking at pre-COVID and during the pandemic. And my presentation will look at 3 items. So first, I will just give a brief overview of the African context. Then I will look at the Kenyan context and give some key messages after my presentation. So when we look at the African context, the design of disability-related social protection schemes in sub-Saharan Africa are less developed. They have limited coverage. Few countries have disability registry. They target the household and not the individual, and most of them are poverty targeted. So with less than 7% of persons with significant disabilities accessing disability-related social protection benefit, this clearly shows that sub-Saharan Africa is among the regions with very, very low coverage in terms of social protection. We have a few exceptions in the region, countries like Namibia, South Africa, and Mauritius. They don't only have disability-related cash transfer, they have concessions, and they're also moving towards disability-related costs. So this is quite welcoming and very optimistic that, in the region, we have countries that, we can borrow from. But again, these are only a few countries. So the other majorities that, they fit the description that I said much earlier. Most of the, persons with disabilities, most of the benefits for persons with disabilities are poverty targeted and don't really go to the individuals with disabilities, but rather to the household. During the period of the pandemic, we've seen bits and pieces and pockets of good practices across the region. And this has been mentioned much earlier. So in Mauritius, they have home delivery of food and other items to persons with disabilities and their families. In South Africa, we have extra payment of disability allowance. In Kenya, we have a temporary disability scheme additional to the regular cash transfer for persons with disabilities. In Sierra Leone, they have an interesting initiative known as the Veronica Bucket, where they're giving or distributing bucket of rice and other items together with a one-off cash payment. So again, looking at these initiatives and a region which has very low coverage, we are quite optimistic that, more and more as organizations of persons with disabilities, we need to engage the government, we need to have serious consultation with them and, get them to understand social protection from a CRPD compliance. The next slide, please. So looking at the Kenyan context, the population of Kenya as per the 2019 census is 47.6 million, persons with significant disabilities is 2.2% of the population, which is about 900 million. And it's very important to note that the Washington short set of questions was used in the last census. We had a very specific question on persons with albinism. And the reason why we had this in the census is that persons with albinism have specific stigma and discrimination that they go through. And looking at the African context, there's a lot of cultural killings targeting persons with albinism. So they're 0.2% of the population, which is about 9,000 individuals. Disabilities under the Ministry of Labor and Social Protection, under the State Department of Social Protection in the Social Development Unit. And the unit has very, very good relationship with organizations of persons with disabilities. Together, we've been able to establish an interagency coordination mechanism. The interagency coordination mechanism has composition from various government departments. It is chaired by the State Department of Social Protection. It has DPO representation and development partners. And together, what we've been able to do first is to develop action plans on monitoring the implementation of the CRPD. We also have an action plan looking at the commitments from the Disability Summit 2018. So the relationship is very good. We also have a state corporation which was established in 2004 under an act of parliament. This is the National Council for Persons with Disabilities. The mandate of the National Council for Persons with Disabilities is first to mainstream disability in both government and private sector, but most importantly, the mandate of the council is the registration of persons with disabilities, which I'll talk about in the next few minutes. We have a vibrant disability movement, and this is under the leadership of the umbrella organization, United Disabled Persons of Kenya. And over the years, the umbrella body has really tried to bring all individuals from cross-disability movement into UDPK. So we have a very good relationship also as organizations of persons with disabilities. We have our own challenges, but more and more we've tried to put that aside and jointly develop advocacy agenda. Next slide. So looking at social protection and pre-COVID-19, Kenya has a program known as Inua Jamii program. Inua Jamii, I can loosely translate it, is a Swahili word meaning strengthen the community or lift the community. And the objective of Inua Jamii is to provide a social protection system through regular and predictable cash transfer to poor and vulnerable households, as well as build their capacity. So the program has 3 cash transfer schemes, one for older persons, the other one for orphans and vulnerable children, and the last one is for households who have persons with severe disabilities. So when we look at the 2 cash transfer for older persons and orphans and vulnerable children, the targeting more is on poverty. But when we come to persons with severe disabilities, then the targeting is both poverty, and one major criteria is the identification and targeting process of persons with disability. So the registration process, as I said earlier, it is led by the National Council for Persons with Disabilities, together with the Ministry of Health. And the procedure for registration is such that one has to fill in the registration form. Then two, there's a medical board that has to sit to assess an individual. So a person has to book an appointment for the assessment. The medical assessment is done from level 3 hospital to level 5. This is at the district level. So people have to travel far distances to go to the district level for the assessment. And one major barrier is that the medical board, some sit only once a month. In some hospitals, they sit twice a month. Again, there is a fee to be paid. So some hospitals charge $3, some charge as high as $10. So you can imagine if a medical board only sits once a month, the number of persons with disabilities who will be waiting on the waiting list, waiting to be assessed. It's quite overwhelming for the medical board, but most importantly, it's quite a huge barrier in terms of persons with disabilities accessing, the disability assessment. So once somebody has been seen by the medical board, the application will be forwarded to the Director of Medical Services within 3 months after assessment. And it is the Director of Medical Services who will give a recommendation on whether a person should be registered as a person with disability or not. So in this, we've seen a lot of barriers in terms of registering persons with intellectual and psychosocial disabilities. And this is because due to the nature of their disability, most of them have invisible disabilities. And coming from a very medical perspective where, the assumption is that disability has to be seen for one to be registered as a person, then it becomes quite challenging for many people with intellectual and psychosocial disabilities being recommended for the registration. So in case then your application is approved, then it will be sent to the National Council for Persons with Disabilities for the disability card to be processed. Again, this is done in Nairobi, which is the capital city of Kenya. It's only one machine that processes the disability card, and people have to wait between 3 to almost 18 months for one to get a disability card. The process is quite tedious. Some people want to go through with it because there is a cash transfer that is attached to it. But again, many people get disappointed when after registering, then you're informed that you're not eligible for the cash transfer. So it has its pros and cons. So the disbursement of cash transfer then, if one already is in the system, is that it goes to the household and it's about $20 per month. It is given every other month through mobile money. Early this year, there was a challenge with the system and people had to wait for 4 months to get their cash transfers. You can imagine the extent and the challenges that persons with disabilities then and their families faced when they stay for 4 months without getting the cash transfer. So to date, we have about 52,000 persons with severe disabilities who have been incorporated into the cash transfer scheme. And this is 5% of persons with significant disabilities with Kenya. So again, we can see when we talk about low coverage, then this is quite low coverage, both in terms of the people who are benefiting from it and also the amount of money that people are getting per month. Next slide, please. So looking at COVID-19 and the response that the government put forward for persons with disabilities and their families, is that the National Council for Persons with Disabilities set aside Kenya shillings 200 million to cushion about 33,300 persons with disabilities and their households. So this was just to caution them against the effect of the pandemic. It's a short-term cash transfer running for 3 months between June to August. Again, it's $20 per month. So it is assumed that in the 3 months, the 33,000 households will receive $60 in total. The criteria for this, again, one has to be poor, not benefiting from any other government cash transfer, must have a valid identity card and disability card. So for children, it is the families who have to provide their identity cards for anyone under 18 years old. And one must have an active telephone number because the system that is used is mobile money. And priority has been given to people with multiple vulnerabilities. So a household maybe with an older person, or a household that is a female-headed household, or a household that has somebody with chronic disease. So the targeting was done at the community level, involving of a multi-agency approach. And one thing that really struck me with the involvement of the multi-agency approach is that it was decentralized to the local level, and it's the local administration who were given the mandate of doing the identification. And what the local administration then did, they got hold of organizations of persons with disabilities. So they kept calling, asking DPO leaders to help them in the identification process. So this was quite rich because it made us as DPOs to sit together, discuss together, and go through together in the identification processes and give our recommendation to the local administration. So again, data for this, because the government had to validate the data, they used the National Safety Net program, which is under the Social Protection Scheme, and the Integrated Population Registration Services for authentication and checking on duplicates. Because again, as I said earlier, they said one must not be benefiting from any other government cash transfer. So looking at the key messages that I would want to pass this afternoon is one, because of the barriers that I spoke about, like in the Kenyan context, looking at the registration for persons with disabilities, there is need to localize and make the disability assessments accessible, not focusing on the impairment, but more and more focusing on support requirements. There is need to invest and develop community services. There is need to facilitate the process of independent living, participation of persons with disabilities. Again, involvement of persons with disabilities, respective organizations, from the design to the monitoring and evaluation of social protection schemes is very, very key to ensure that it is CRPD compliant. Disability social protection schemes, they have to be compatible to the right to work. They have to support economic empowerment of persons with disabilities and enhance socioeconomic participation. So one criteria of the in the Kenyan context is one must not have the capacity to work. One must be, and I'm quoting what the government says, one must be bedridden and in need of care. So there's need to move from this to more and more on economic empowerment. And then the targeting criteria, I spoke about this, but most importantly, when we talk about the targeting criteria and the disability support and participation is that, inclusive social protection schemes should enhance or foster personal autonomy, independence, and choice. Yeah, so thank you very much. Back to you, Alex.
Thank you very much, Fatma, for this overview of the situation in Kenya. And thank you for showing how the challenges that exist prior to COVID-19, how they have undermined part of the response, but also how the collaboration with DPOs and the engagement between government and DPOs have allowed to overcome some of those difficulties. I would like now to give the floor to Johnny Yulanto from Sigab in Indonesia, where DPOs have actually run specific surveys to measure the impact of COVID-19 on persons with disabilities. Johnny, the floor is yours.
Yeah. Thank you, Alex. Good morning, afternoon, and evening, everyone. I'm Johnny Yulianto from SIGAP, a local DPOs that actually work more at the regional level. But during the COVID-19, we gathered in a network, DPO network, that works together for a more inclusive response to COVID-19. So first, a little bit background of this network. So this network is actually a flat network that was first informally established in March when we started informal discussion, online discussion, looking at update around the situation of DPOs, person with disabilities in many different regions when COVID-19 happened. So then we decided to do a national survey looking at how COVID-19 is impacting toward person with disabilities. So next slide. This is the element of the survey that we are conducting. So we conducted this survey during April 10 to 24 through online and offline. So we use Google Doc, and we also do a direct interview for those who are not able to get access to the internet. And then we covered 32 provinces out of 34. This is because in the other 2 provinces, there have been few engagement or few DPOs that are active, so this survey really rely on DPOs in the provinces that are involved, because this is more like voluntary work, and we don't really prepare that much time. So we had like only 2 weeks to work on the instrument, and then straight forward with the data collection during April. So next slide. So this is the profile of respondents from our survey. So majority are men, around 50. This is actually 54%, and then 42% women and 2 others. Majority of respondents are within productive age, and also in terms of disability, majority are those who have physical disabilities, followed by those who are in the sensory disability, and others following. So we can say this is not ideal probably in terms of sampling, but we do snowballing so that even in each provinces, we don't have like ideal sample number of the respondents to this survey. Yeah, next slide. So actually in our survey, what we are looking at is a number of sectors. So we are looking at the availability of accessible information on COVID-19, whether or not informations are accessible. We are also looking at how COVID-19 has impacted toward or becoming barrier for access to health issues, health services, education, services and some other services. But in this webinar, I'm going to focus on one of the findings related to the economic impact and how social protection actually has contributed to help this situation. So looking at the economic impact, the purpose of this element is to identify actually what are the groups that are impacted the most, and also again how the scheme of social protection that are existing could help this situation. Well, also we want to see how this situation can be improved later actually. So in terms of who are the most impacted, we found that people who are in more severe disabilities, they are more impacted. And also people who work in informal sectors, they are groups that are in fact impacted the most during the first month of COVID-19. They experience decrease of income up to 50 to 80%, and 86% of the respondents are those who experience the decrease of such significant decrease of income. They also become difficult to afford basic needs in daily life, and also for those who are in need of additional costs like therapy and other disability-related needs. Most of them express that during the first month of, even during the first month of COVID-19, they have to stop it because first is the expenses that they don't have because they stop the income, but also the second is the services. For example, hospital, they stop because they have to focus on the COVID-19 recovery. So in terms of the scheme of social protection, as you see, the highest number or the highest percentage are electricity subsidy. So around 35% of respondents, they are able to access the electricity subsidy. And this is because the electricity subsidy is newly launched during COVID-19. So this is not the existing scheme before COVID-19. And because the criteria is actually based on the power subscription. So if you are subscribing to the 900 watt or below, you will automatically be subscribed, be registered for this subsidy. But still 35% is low because many people with disabilities, if we are looking at the demographic profile of this assessment, they mentioned that they are not staying on their own house, like they are renting, or they are joining with other extended family. So they are not managing their own house, so they might not be paying for the electricity on their own. Water subsidy only around 5%, and this also actually new scheme, but in Indonesia, most of people are not subscribed to kind of water because they have their own like water sources. Cash transfer, only around 4% who get access to it. And I can say that this cash transfer is actually based on poverty criteria. So it's not disability is not considered as the criteria for receiving this cash transfer. And also additional information about this is that during the first month or second month of the COVID-19, the coverage of cash transfer, for example, is still on the way to be expanded. So this might be because during this time there has not been expansion of the coverage for the cash transfer. There is also a scheme like non-cash assistance, like food assistance, and 11%, quite high, of the respondents are receiving this. And this is new, actually new schemes that happen after COVID-19 happened. Conditional cash transfer quite high, 13%. But still, actually 13% given the impact is not quite significant. And there actually has been expansion of the conditional cash transfer that include disability as criteria since before COVID-19 has happened. But there is also issue with data in Indonesia. So only the disability data that are quite good is still part of those who are under poverty criteria. So we still do not have accurate data by name, by address for all persons with disabilities, because also all social protection that requires by name, by address data is actually mostly based on the poverty criteria. So based on this finding, we come to identification of the key problems that needs to be addressed by Indonesian government, and we put this as a recommendation. So first, the recommendation is focusing on the accurate disability data, and also it is important to understand and to address the barrier for the economic empowerment of persons with disabilities. So it is important, while currently government is focusing on working on economic recovery, that also persons with disabilities are targeted in the economic empowerment, particularly those who work in the informal sectors. The second recommendation is we propose that disability criteria is important to be considered in the scheme for social protection. So this is something that still doesn't exist for the majority scheme of social protection in our country. And the third, while social assistance is still very important with this current crisis, but it is important also to combine with economic empowerment that is inclusive. So what happened at the moment is that social assistance still like separate with the economic empowerment program, and this is probably because the two are managed by different ministries, and in our cases, even programs that are managed by similar ministries but different directorate, they might not be communicating each other. So we want, so this might be not only in the importance of coordination, but also synchronization of programs that really support and match each other. For example, in certain period of time, people must be targeted with the social assistance, but then also at the same time supported with the program for their economic empowerment. And this needs to be inclusive of persons with disabilities and without disabilities. So this is the sharing from Indonesia. Again, thank you very much for the opportunity, and return to you, Alex. Thank you.
Thank you very much, Johnny. And before we open the floor for few clarification questions, I would like to give the floor to Meenakshi Balasubramaniam from India to give us an update on the situation there with regards to social protection and COVID-19. Meenakshi? Hello, Meenakshi?
Yes. Can you hear me?
Yep.
Okay. So this is, thank you for this. Sorry, my connection is like not proper. So this is an initial analysis of social protection and COVID response and persons with disabilities in India. This report has been acknowledged and co-authored by many disability organizations, DPOs in India. Next slide, please. So due to COVID and the impact of lockdown,
Meenakshi, it seems that your connection is not strong enough today. We can't hear you. Yep, I apologize, dear colleagues. It seems that Meenakshi's connection is unfortunately not good enough today. So I would suggest that we open the floor if there is any clarification question with regards to presentation from Indonesia and Kenya, and then to see if Meenakshi can come back. Is there anybody who would like to address the two panelists so far?
hello.
Yep, Meenakshi.
Hello.
Yep, we hear you, Meenakshi.
Yes. Okay. So that we have lost out on our regular support and specific support services. 42.1% of the respondents to the same survey expressed lack of access to support services. All this has led to high risk of isolation, starvation, and many times death. There are many media reports on starvation and death of persons with disabilities. Next slide, please. So what is the government's response to this? So the government has, in general, at the union and at the state levels, they have come up with cash transfers, supply of food grains, moratoriums on loans, particularly for micro, small and medium enterprises, and waiver from duty for certain populations. At the state level, the provincial level, there has also been cash transfers, advancing of pensions, and helplines. Specific response to persons with disabilities include, at the union level, there has been a one-off top-up to the Indira Gandhi National Disability Pension, which is the National Social Assistance Program of 1,000 rupees paid in 3 months in 2 installments. Apart from that, the Ministry of Social Justice and Empowerment has come up with guidelines to ensure accessibility of services for persons with disabilities. As far as the states are concerned, provinces are concerned, there has been specific helplines for persons with disabilities. They have ensured food supplies and supply of free rations, advancing of state-specific pension and cash transfers in some states, exemption from frontline service. In Tamil Nadu, one of the states has made specific announcement of cash transfer for all persons with disabilities in the state who have access to disability ID cards. Next slide, please. But however, we find this response to be too little and too few. There is no coverage for children with disabilities, and only 7.6% of working age persons with disabilities are covered by the NSAP, which is used as a vehicle to provide COVID relief. The survey conducted by NCPDP revealed 63% of those surveyed did not receive any form of pension. Another survey by Site Savers and Rising Flames among women with disabilities revealed that none of the women surveyed have access to this pension. Next slide. So why is the support insufficient? Because we find that there has been no effort on the part of the government to address the pre-existing barriers on the design of the scheme, which mandates access to only those who have more than 80% impairment, those belonging to BPL families, and those who are certified as having cannot work. And also issues around disability certification and ID cards. All this has led to low coverage of the benefit itself. And I have presented it by way of Indian map with state boundaries and with different shades, representing that, the coverage, the range of coverage. And we found that in as many as 34 states, the coverage has been less than 10% of the working age population of persons with disabilities. Another major issue is the inadequacy of the benefit in comparison to the poverty line, which is $1.90 per day per person. Put together the state as well as the NSAP benefit, the cash transfer, we find in as many as 22 states, the benefit has been less than 20% of the poverty line. Again, this I have depicted by way of the India map with state boundaries highlighted in different shades. Next slide, please. On the Tamil Nadu benefit, which I was talking about, the one-off cash transfer, we did a rapid survey and we found that 60% of the respondents do not have access to this benefit. And among those who had access, 56% experienced challenges in accessing the benefit. And 67% of those who did not receive the benefit expressed that they had information, but the lack of implementation process and mechanisms failed them from accessing the benefit. Next slide, please. Another major limitation is the budget. So the public expenditure that support inclusion of persons with disabilities, I have taken the 2019-20 budget estimates. We found that overall, both union as well as states put together amounts to only 0.04% of GDP and 0.22% of public spending. Whereas only social protection, it's only 0.03% of GDP. So this is inadequate to address the pre-existing inequalities experienced by persons with disabilities.
Dear colleague, I apologize again. It seems we lost Meenakshi again. I just project now the last slides of Meenakshi, which was including the recommendation, which was expanding the disability scheme, the pension, in terms of value of coverage to all persons with disabilities, taking steps to ease access to the disability ID card, which is a requirement to access several support, compensate disability additional costs for for children with disabilities and persons with high support requirement, ensure accessible information and communication services, take steps to collect data on persons with disability at all levels, and ensure availability of community-based rehabilitation services. So I would like to, if anybody would like to have clarification question on some of those presentations, you can raise your hand. No.
Alex, there's just a question in the Q&A section.
Yep.
Yes.
So Diana Samarasan from the Disability Rights Fund is asking to Fatma, Johnny, and Meenakshi, which donor have been supporting the work that you have been doing? For instance, Johnny, the survey in India, in Indonesia, or Meenakshi, the policy paper that you have done. Fatma, if you want to take the floor and answer that.
Thank you, Alex, and thank you, Diana. In Kenya, we haven't done a survey. It will be very important for us to do one to just to show the impact on COVID-19 amongst persons with disabilities and their families. But we have a few donors that have supported work on purchasing of PPEs to be distributed to persons with disabilities and their families, and wash facilities. So some of the donors that have supported this work is like the Open Society Initiative of Eastern Africa, the Voices Project from Netherlands, and NORAD. And also part of, that support has been developing accessible information on COVID-19. Yeah, so that's all that has happened in Kenya. Thank you.
Johnny?
Yes. In our case, actually, we really began with the DPOs initiative. So we started with no donor at that time, and I, based on my observation too, during March, April, seems like people are like still in the situation to observe, and a lot of DPO colleagues also experience the situation where still like negotiation of adaptation of activities like that. So we really started with voluntary basis of organizations who are involved in this survey. DRF, some of the grantee organizations involved too, and I heard also have some like flexibility to reallocate their activity work, their grant for addressing this issue, and they are quite active to be part of this survey. And later, then several development agencies joined to work together on the analysis and also dissemination of this report. So I think the interesting part of this assessment is that this has finally attracted the attention of different programs, different organizations to start looking at this issue and see how they could address the situation based on their program that they are doing. So, for example, now a couple of other development programs they are doing further advocacy and also deeper research and work to provide like technical assistance to government on some of these issues like education, information, accessible information, following up this finding. Yeah, thank you.
Meenakshi? Yep. Seems Meenakshi is not back. So in the case of India, part of the work was supported by the UNPRPD projects on inclusive social protection. Yep, so I would like now to invite, so we have a question from Penny Ines from DFID. Do the panel have reflection on what works to influence governance on social protection system? Why do the system in Namibia, South Africa, and Mauritius have better provision for people with disabilities? Maybe if I can suggest, because we are running a bit late, I would like to give the floor to Hélène Salmon from the DFID GIZ help desk, which will share with us the experience of mainstreaming disability in the support provided by the help desk, and maybe some of the entry points they have found in bringing the issue of inclusive social protection. And we will come back to the question of Penny just after. So Hélène, I will project your presentation, and then you can tell me when to shift the slide.
Thank you very much, Alex. And hello, everyone. And thank you for the opportunity to talk to you today. It's been very interesting for me to listen to the presentations that have taken place. I'm thrilled to be listening to all of the work that you're doing. And what I'm finding is that it's very timely, it's very exciting, and it's incredibly reassuring to know that even if our journeys have taken us down different pathways, it seems that we're all reaching similar destinations or conclusions in terms of social protection and people with disabilities. So, Alex, if you can move to the next slide, please. The Social Protection Approaches to COVID-19 Expert Advice Helpline is a facility that is funded by the UK and German governments. And it recognises that the national governments are at the centre of delivering social protection responses to COVID-19. And this advice helpline is to encourage and support governments and their implementing partners to think through how to maintain or adapt existing systems and programs to respond to the different needs. Up till now, the helpline has worked directly with about 50 countries all over the world, and is now moving into more of a consolidation phase, looking at sharing best practices and learning on COVID responses around the globe. Advice can be requested directly through the SPACE helpline, and I'm guessing that Alex will share these presentations after the event, and if you receive them, if you just click on the links, it will direct you to where you can come if you want to find out more. Next slide, please, Alex. The COVID-19 helpline, the SPACE initiative, if a country contacts the initiative, we then have a scoping call with them to help us jointly figure out and understand exactly what it is that the country is asking for, because sometimes people know they want support, but they're not quite sure what that is. It combines that with the direct advice specifically for the country and with thematic analytic pieces. So, for example, right at the outset, we started with quite a major piece on gender and inclusion in social protection responses. That has now moved and taken on a new phase, and we're looking towards implementation, which incorporates gender and inclusion. There's a number of other matrices and sort of general global guidance that people can rely on. There's also country-specific support. So I think it was Fatma earlier on mentioned Sierra Leone, and we have recently worked with the government of Sierra Leone because they had some concerns about their identification and selection process, which they had hoped would be more inclusive, but actually, because of the proxy means test, was actually excluding persons with disabilities, even though they were in lower income households. There were other exclusion errors. So we've worked with them to provide some background on hints and tips on inclusion. But I think the most important thing to say is that the SPACE COVID helpline is trying to introduce inclusion in every single response. So we look out for gender issues, no matter what the thematic subject area is, whether it's targeting, whether it's cash response, whether it's in kind, no matter what. And we look for gender issues, how we can work better to support women, how we can look better to support women with disabilities, and how we can look at more inclusive approaches that integrate persons with disabilities from the outset. So next slide, please, Alex. Through this process, what we've learned is that it's very easy to make the case for why people with disabilities should be included. We've seen already today in some of the presentations that data has come through where we know that people with disabilities are impacted harder than anyone else through COVID. Even those people who were likely to be in employment, most will have been working in the informal sector. And we have estimates from ILO that at least 76% of the informal sector has been severely impacted. We know that people with disabilities can live in households with reduced income. They're less likely to be protected by social insurance, all of the things that you've come up with. And it's definitely worsened the situation for women and girls who already experience intersectional exclusion. So we know what is happening to people with disabilities, but where the next stage is, it's how do we make the case for how to include them? And this is particularly difficult, again, as you will know very well, but we're finding out because there's a dearth of evidence, there's very little evidence on inclusive measures, systems for social protection which automatically are inclusive of persons with disabilities. It's also been challenging because to some extent, there is a relative invisibility in the population in many, many countries because of the prevailing social norms, and this contributes to that. There's also considerations around the complexity of disability, because we know its definition is very dynamic, it's multidimensional, and in some countries it can be contested. And prior to COVID, we know that there was limited investment in the institutional architecture, including the technical capacity. And overall, there's very limited evidence. But I mean, the bottom line is that people with disabilities live in households with lower income and are likely to have higher costs. And I think it's that part about the likely to have higher costs that doesn't get recognised enough, and particularly when defining the social protection measures. We know, and this has come up in the previous presentations, that there's large exclusion error from registries. There are huge challenges in identification and registration of persons with disabilities. And again, this is something that we're talking to individual countries about. We've spoken to Alex and his team about, and we will continue pushing for. Next slide, please. But at the moment, I think there's an opportunity. And again, talking to my colleagues in advance of this presentation, we know that there is, our discussions are tending towards what can we do right now to improve this situation? What can we do right now to get to the how, to make sure? And at the moment, we believe that there's an opportunity for a big win if we all act now to get the right data. We know that there are many, many countries which are including disability-specific questions in their household data collection formats, and that these questions don't require specific technical capacity to collect. But the range across the different countries is variable, and in some cases may be useless. So I've seen one household data collection form that just asks point blank the person, does person X have a disability? Now that really is not going to help. I heard Johnny earlier on in his presentation talk about using Washington Group questions in the census, in the population census in Indonesia, I think. And some of those short set questions are being incorporated into household level surveys for social protection. So our big pick now is that we believe that identifying a set of standard questions for inclusion linked to a social protection indicator on disability, which I think is something that you've already maybe started talking about. We believe that those two things combined could create some momentum and opportunity, and at the same time advocate for policy acknowledgement across all countries that inclusion of people with disabilities must require acknowledgement of the higher costs associated with disability. So next slide, please. There is somewhat of a sense of urgency because data collection is happening now, partly because it would have happened in many countries anyway, but partly pushed by the COVID-19 response. We know that a lot of people are out there collecting data to create these registries, general registries for social protection. And we know that these registries can be static, that once the data is collected, it can sit there on the database for a number of years before it is reviewed, renewed, and updated. So if people with disabilities are not on the registers being developed now, they will continue to be excluded. And getting them on the registry now, even in places where there's currently no provision, no social protection provision, is vital so that the advocacy for access can be based on good data. And in conclusion, so as not to take up too much time, the question over to this particular working group, this expert group, GLAD, is to say that space can use their influence and reach. Now is the time. And really as a group, whether GLAD and space can come together to take this forward and to think about what this means in quite the immediate future. What can we do collectively to take this particular initiative further? So I think I will leave it there, and that leaves us maybe an opportunity for some quick Q&A or just general discussion on those kinds of issues. Thank you very much.
Thank you very much, Elaine, for this quick overview of the work and issues and potential way forward. I think you really highlighted again this issue of registration and identification, which is paramount. Is there any question or contribution following this presentation? Not yet. Okay, I would like to briefly go back and give the floor to Ola Abu Al-Gaib from the UNPRPD. Ola?
Hello?
Yep.
Yes. Hi, welcome again. Thanks, Alex. So what we wanted to just update you on, again, in relevance to all the discussion that has taken place now in terms of what's going on globally in country around COVID and disability inclusive response and recovery. And also coming back to the question of Penny, how are we going to really understand and learn what's really working to support countries in terms of their attempts to be inclusive around disability on social protection and taking the opportunity, it's not an opportunity, but really the chance to look more deeply around COVID because it has the specific attention to sort of common situation across the globe where disability has been highly affected. So one thing we wanted to share with you is a global initiative that was put forward by the members of PRBD a few months ago as a response to the COVID crisis, making sure that countries in action where PRBD is operating, which are 30, but also beyond, because our members are operating in, in many countries on social protection, but also across other thematic areas, is to make sure that disability is on the agenda of governments when it comes to immediate emergency response on disability and COVID, but also beyond that when it comes to the socioeconomic recovery plans and implementation strategies. So the program really brings together all the 9 UN agencies that are members of PRBD, but also is done in partnership with the International Disability Alliance and the International Disability and Development Consortium. And it brings the expertise of all the members to make sure that we are providing the immediate support to countries in terms of understanding what entails to be supporting governments to be inclusive in their immediate response. And that entails not just social protection, but social protection is one of the key areas, but also it entails health, education, addressing issues of protection from violence, sexual reproductive health services, but also looking at the government's approaches to monitor the current situation and make sure that there are no violations when it comes to the situation of persons with disabilities. So the first outcome or the expected result of this is really will be translated in producing immediate checklists, guidance notes, provision of technical assistance to countries, but also we're planning a series of webinars that will be provided not just to the UN country teams, but also to all national actors that are involved in our programs and beyond, to have that unified understanding on issues equal to social protection, but others as well. The second component of the program is really making sure that organizations of persons with disabilities are engaged in all the processes planned in the program, meaning from the starting point of deciding which tools are needed, to the delivery on the ground, to the relevant actors, but also thinking beyond that, what do we need to have in place to push governments to learn from the current situation when it comes to disability inclusion and COVID recovery plans. And that entails making sure that OBDs are partners in the whole process, but also that whatever is produced from the program will be accessible and available to them to use in their own advocacy and access to information activities. The third component, which is very important, and again, it responds to the fact of learning from what's happening now, is we're supporting different initiatives from entities to generate data from countries in terms of what is happening right now, translating into country profiles, case studies, learning documents that we will be putting together in a global document that will guide BRBD's future work on how do we shape our future funding to, again, ensure that we are providing the right guidance to country teams and other relevant actors to push governments to be inclusive. And that, as I said, will provide hopefully an updated evidence that will be useful even beyond our fund and partnership, but also for us it is making sure that we are making effective use of our resources for the coming 3 to 5 years, where we know that COVID will continue to have implications at country level, but also even for, unfortunately, there will be other crises coming in the future, and it's good to capture the learning from that. I'm going to stop here, but it's really this initiative we will constantly update this group on, specifically on what comes out of it when it comes to social protection, and Alex will explain that a little bit more now. But even whatever comes as relevant to have this cohesive learning, we are happy also to share with the members here. Thank you, Alex, back to you.
Thank you, Ola. So briefly, we wanted to share with you the social protection component of this program, which will basically start somehow with a lot of activities have already taken place, support to DPOs and others. But two elements that are, I think, particularly relevant for the GLAD working group is the investment case paper that we are preparing, which is basically articulating some key message that we want to share with you with regards of building on what our colleague just said, Elaine just said, why is it important to invest in inclusive social protection and economic recovery, and how basically making the case for a universal and inclusive social protection investment. We have started developing different thematic briefs. Many of them are in draft form and will come out early September. We are also working on handouts and videos for DPOs to get a better sense of those social protection challenges and helping them also, as Elaine said, to shift from the why to the how and be able to be counterpart in this conversation. And one of the things I really wanted to highlight is, because it partially answered to the question of Penny, we are building on the work that DFID has done with development pathways. We are working with development pathways, but also CBM and DFAT in doing at least 10 country case studies, looking at pre-existing social protection system, response during COVID-19, and trying to learn from that. One of the points I think you mentioned, Penny, in your question, which is why some countries have more developed system than others when it comes to social protection and persons with disabilities, and we will try to partially answer those questions. Another element that we are doing, and which is the overview of the measures that are taken, which I shared some elements earlier. And a core thing that we have been doing in the last weeks and months is actually an online professional training on social protection and inclusion of persons with disabilities with the Bonn University for 65 UN staff, DPOs and government staff from 25 countries. We have 2 rounds, the summer round that will finish in September and the fall round that will finish in end of November, where we basically support this multi-stakeholder group in developing more skills on first building the rationale of why inclusive social protection, but also, as Ellen mentioned, the how. What are some of the key elements that we need to take into consideration? And I think if you look at Namibia or Mauritius, one of the key aspects is that from the beginning, the benefits have not been linked to the incapacity to work, which basically broaden the scope of coverage that they may have, but they are other elements. And in South Africa, clearly, even though it's, for instance, linked to incapacity to work, it's not poverty targeted, but affluence tested. And in Mauritius, Namibia, it's universal. And there are also political framework behind it that are beyond disability, that are more about the social compact and what social protection role, what role social protection should play in society, which are different. So we are trying to build on that in working with the colleagues in this training. And all this work is supposed to contribute to a synthesis report on COVID-19 response and recovery, which will join the broader UNPRPD program lesson learned. So we wanted to share with you some key message and the narrative that we believe is important to make overall and in detail. So before COVID-19, persons with disability were facing strong inequalities. The level of investment, coverage, and adequacy in terms of social protection and support were too low across low and middle income countries. And we have evidence now, in the last 2 years, I think, between ILO, UNICEF, DFID research, DFAT promoted or financed research, we got more evidence of this inadequacy of support and this very low level of investment. And we saw, and evidence that are gathering step by step really show how those inequalities and low level of support have been magnified by the crisis. And that countries who have more developed social protection systems have been in better position to provide support. So this leads to the need to expand progressively universal inclusive social protection support for children and adults with disabilities in combination with economic empowerment measures. And in terms of details, so those, I won't repeat, but those were some of the key elements I shared earlier. And I think that the point that Elaine was mentioning about supporting countries to develop national disability registry, but also include disability in their broader registries. Different countries have different systems. For instance, Senegal decided during the COVID-19 crisis to include all the disability card holders in their unique registry that is supposed to provide support for vulnerable households and individuals. So there is a combination of the possibility of combining also national disability registries and broader registries. And how do we make sure that whatever the way that the countries has taken from a start, at the end of the day, there is a comprehensive administrative information system that really provides the information that the government needs to provide support to persons with disabilities. So it's already 4:10 Geneva time. I wanted to see with you if there has been some specific question. Diana, I see, since one of the recommendations is to work collaboration with DPOs in providing advice to government, we know that not all umbrella DPOs are inclusive of marginalized groups. I think it is critical for all of us to keep in mind this recommendation when making a recommendation to government about working with DPOs. That's indeed a very important element. I think both in Indonesia and Kenya and India, those are examples of countries where, because of the support, for instance, that DRF has been bringing to most marginalized groups, there is a trend and to have a more inclusive movement, but it's unfortunately not true everywhere. And that's something that needs to be taken into account. And it's particularly important when it comes to national disability assessment and identification. One of the biggest issues would kind of block us in providing guidance is issues related to persons with intellectual disability and psychosocial disabilities, which, because of invisibility of the disability, create additional hurdle to provide a low-cost, localized assessment scheme. And this is why we are building a guidance that is more based on multi-stage approach. And we will come back to all of you with regards to that. I do not know if anybody has burning question or comments at this stage. What we will do, we will share all those PowerPoint with you and related documents. Don't hesitate to contact any of the speakers for further information. And we will come back to the GLAD working group also with this investment case and those big high-level advocacy message, trying to see how GLAD as a network can also support and endorse those messages. Ola, if you want to have any concluding elements.
No, thanks again for everyone to join us, and we look forward to group again, hopefully sooner than our previous duration, with more updates, as Alex mentioned. But yeah, feel free to reach out if in between you would like us to provide further details. Thanks a lot.